Now, monkeypox is a disease of close contact and the risk to the general public remains low. That's according to the head of the World Health Organization's Smallpox Secretariat. So far, European nations, the United States, Canada and Australia have confirmed or suspected around 200 cases, with numbers expected to rise as more medical practitioners now look for signs and symptoms. Well, for more on this, let's chat to Medical Expert Professor Ramneek Ahluwalia. Prof, great to have you. Thanks very much for being with us.
Morning, Leanne, and morning to everyone. It's an absolute honor. Thank you.
Let's start right with the basics. What is monkeypox?
So, monkeypox has been with us over the last 5 decades, or 7 decades, as mankind has known this virus. So when COVID-19 came in 2020, it was unfamiliar to us. We never knew anything about COVID-19. And that's why there was a panic. But when monkeypox has now come, it's something we are aware of and it's been with us. It's a zoonotic disease. What it means is it spreads from animals to human. And that's how it spreads. So it spreads from rats, rodents, squirrels, a family of rodents, and then also monkeys, because it infects monkeys a lot. And what monkeys experience is a full-blown monkeypox as an infection. And humans which are in close proximity to rodents or in close proximity to monkeys, in fact, can get it from the animal to a human. And that's what has been monkeypox for us as humans getting infected. But what we've seen is small outbreaks confined to a particular geographic location, mostly seen in the past was in Western Africa or Central Africa, remained there, single digits or maximum early double digit numbers of people getting infected, but very easily contained. And now what's happening is a wider geographical spread, many continents involved, and that is putting alert and concerns for the entire scientific world at this moment.
Yeah, which is, I suppose, putting question marks about it, because the very first case, as far as we know, was a traveler that was returning from Nigeria, where it's an endemic in Nigeria, as far as I can understand, here in Africa, and moved back to Europe. And this was apparently the first case. And since then, it's been detected, as you were saying, in many, many countries. I mean, whether we're talking, I did just a quick look at where we're at the moment, and I'm sure these numbers have changed. It's been in Australia, 2 cases, Austria 1, Belgium 3, Canada are sitting at about 22, France, Germany, Israel, Italy, Netherlands, Portugal, Spain bearing quite a lot of them, 50 cases, Sweden, Switzerland, and the UK at 20. So the reality is this is something that's never been sort of seen before, the spread happening in areas that had not really got smallpox. I beg your pardon, not smallpox, although they are quite similar, but this is monkeypox. So talk to us about what scientists are thinking, what's going on.
So monkeypox is definitely from the same family as smallpox, and smallpox is a very dangerous disease. The important thing is we eliminated it. We actually eradicated this disease. We're very proud. So monkeypox is, though, from the smallpox family, but it's a very milder version of the smallpox. That's what we've known for over the last 7 decades since monkeypox has been in origin for mankind to know about it. But as we speak in COVID-19, viruses evolve, which means viruses mutate. And what we are suspecting is a slightly more transmissible way of this new variant. It does look like to be very closer to the Western African strain that always existed in the endemic zones in the Western Africa. But now this new strain, which is absolutely going beyond the geographical location, spreading slightly more quicker than it used to, because the spread of this infection should not be as quick. It takes long proximity and in contact with fluids, in contact with contaminated blood, or sexually transmitted ways, or kissing where you have in chicken pox, or if measles, you get pox on your faces, which means there are blisters. And when the fluid comes out from the burst, it spreads from one human to the other. But it needs very close proximity for it to spread. One thing is clear, is there is viral evolution, there is a viral mutation in this virus, and what is seeing is that this virus has now become a strain which is more transmissible. However, new scientific data and genomic studies will confirm what we're saying, but seems to be very clear in that direction. And that's why there's an alert, there's a bit of a concern. Why is it spreading? And of course, our travel systems have improved quite drastically, which means once you're infected, you are bound to take it very quickly.
Yeah.
With the incubation period of 21 days, we still have to watch how many more people are still in the same period of incubation, which means the numbers are definitely going to rise from the look of things. And as I said, it's already crossed geographical boundaries. So as South Africa, we need to be on alert for a bit.
We certainly do. I want to go into the territory where, this is now being spoken about, the World Health Organization. They are saying that this has predominantly, and please correct me if I'm wrong, these are just reports that I am reading right now. They're saying that they've identified most at risk at the moment, that this seems to be spreading amongst men who have sex with other men. Is this where we're predominantly finding it? I know this is sensitive territory, but it just reminds me of the HIV/AIDS talk, and then it was realized, no, this is much bigger than that. But this is where they're finding predominantly the cases happening. Is that what you're hearing and seeing as well?
So definitely it's always about a contamination through a body fluid or blood or a fluid from your pox. Which is through a droplet, but not as quick as the COVID-19. It's not an airborne disease.
Yeah.
So sexually transmitted way is one of the ways. It can be both in the heterogeneous or the homosexual ways of transmission. Currently, we might coincidentally would have seen many cases of men having sex with men transmitting, but even heterosexual individuals will also have experience, because it's a sexually transmitted possibility of infection that we're seeing in the current virus spread. So my point is it's a fluid to fluid contact, contaminated places, body fluids, which is blood, and any sexual transmission involves a connection to the body fluids together, making it possible, including kissing at times. When you have a face, because the face is a big area where the vesicles start building in the smallpox symptoms. So kissing at times is also close proximity and very close proximity in the transmission. So these are all the means and measures. I would not confine just to the men having sex with men. It's STIs in general.
Yeah, thank you for clarifying, because when you read further, you can see that this is also through, respiratory droplets, speaking to one another, me speaking to you, and we unfortunately, just that's the way it happens. It spreads, and they're saying that it can also spread through respiratory drops that may be on a surface, and you touch yourself. It's just... Forgive me for alarm bells for going off, because we've been here less than 2 years ago. We started to speak about something called COVID-19, and it seemed so foreign. It was happening elsewhere. Then suddenly it landed on us. Please tell me we're not heading into another pandemic, or is this something different?
For us, for now, it looks like to be an outbreak. An outbreak means as much as it's spread around the geographical locations, the monkeypox from history has been not like its sister, like a smallpox, a very fast-spreading virus. It means it needed always a close proximity and long, prolonged proximity, contaminated fluids. Yes, respiratory droplets, but it takes very long proximity to do this. If the transmission rates have changed, which we are seeing now through the numbers rising, if the virus has mutated, one cannot rule out an epidemic or even a future pandemic. It's already spreading across continents, so the word pandemic does come into our minds. We still believe as scientists that this can be an outbreak only, which means still remain into those. It has gone to a triple-digit number, maybe a little bit further, but the outbreak can be contained. The good signs we have is we know about this virus. We know the smallpox vaccine exists. We know smallpox vaccine will predominantly be 85% plus effectivity in this virus, against this virus. We know we have antivirals as a treatment that will definitely be of support and effectiveness. Plus, monkeypox is not as fatal for now considering the strain that we are investigating right now. However, too early signs and too early data for us to explain this part.
Yeah.
So there are many positives that we can look into monkeypox comparative to COVID-19, Leanne, when it came, which was unfamiliar to human man science, or our immune systems were not even built. We never even thought of even having a vaccine at that moment. So two different diseases, we won't confuse them. COVID-19 is absolutely a very fast transmissible airborne disease right now, whereas monkeypox for now still believes to be a virus that be known to human mankind, still needs a lot of proximity, a lot of close contamination to be able to spread, uncomparable to COVID-19. We do believe this should stand. However, viruses do surprise any scientific world, but for now it stands, and we not want to create panic and say we can contain this outbreak.
Just very quickly, Prof, how dangerous is it? I mean, we've been reading the list of signs to look out for: rash, fever, body aches, all of these kind of things. But how dangerous is it? Have we actually seen, as it stands now, any fatalities, or is it pretty easy to recover from?
So for now, we haven't seen any fatality, but still it's very early days, because, the viral evolution in the human body takes time. It's only around the 12th and 13th day, at sometimes around the 5th or 7th day, when the body flares up with the proper viral infection. However, I would still say, so no fatalities for now. We haven't heard of any part of the world reporting. Expect a 3 to 6% fatality, and the kind of strains we are talking about, which means out of 100 people, there's a possibility of 3 people to 5 people who can pass away or unfortunately die, and every life is precious at the end of the day. What people have to watch is pregnant women, people who are, older, elderly, with people with comorbidities whose immune systems will not be as strong enough to take the burden of this virus. We pray that it doesn't come to South Africa, because in the winters, we already have a COVID-19 threat on us. We've got an influenza threat on us. We can't have one human body dealing with many different viruses at the same time, because even a strong human body will succumb to multiple viruses should they enter the same time into the human system. So yes, we should be guarding out and watching because of our winters, close proximities, again, indoor settings and indoor congregations in winters do help in spreading of any viral diseases, and specifically something, even though as monkeypox will take close proximity, but it's a possibility. So we need to really watch out. I think the health system should be on alert. The Department of Health should be absolutely watching any cases of report, and also to the health practitioners who will be on the front line dealing with it.
Indeed, and reporting cases, if any, start emerging. Quick final 2 questions, if you can answer them quite quickly. Are we going to be seeing more vaccines coming our way? Are we going to be queuing up again to get another vaccine?
So if this outbreak is contained, which is highly possible because of the previous, even though it's become slightly more transmissible, we've always seen the history of monkeypox with only 2 digits and very confined outbreaks and easily controllable outbreaks. But should this virus surprise us, and it moves to a direction of more transmissibility and spread and converts into a pandemic, yes, then there's a possibility that we need to start looking into a smallpox vaccine, because vaccine is preventable and it's something we are aware it can help. Yeah. But for now, I would not panic. Still believe, fingers crossed, and still believe it will be an outbreak and it will be contained in a number of days, if not few weeks from now. But if it doesn't, then of course these questions start looming into our minds.
And then, just as I let you go, it is 8 o'clock, but I just want to get this talk on COVID. Was that the 5th wave? Is this the 5th wave, or are we still yet to see the 5th wave? What is going on?
I do not think it was a 5th wave. It was a blip. It was a major blip. Comes out of 3 big reasons. We came out of a festive season, lot of intermingling. Unfortunately, South Africa at the same time got a winter wave which confined people into close congregations, into socializations together. wearing a mask came down at the same time. People did lift their guard down. And similarly, yes, the same Omicron that existed did convert itself into, which is a normal viral evolution, converts it to a slightly more transmissible virus, a slightly more immune evasive nature, which it will do to survive, but still was an Omicron family. I do not think it was a fifth wave, though some of the provinces did enter, as per the definition, into the early part of the fifth wave, but it was a major blip. However, what we anticipate as scientific world is that there can be a new variant in total, which obviously has the potential to immune evade, have more transmissibility, different slight of clinical patterns, and possibility of replacing Omicron can happen in winter. So we need to be very vigilant. However, no signs yet on that ground. And good signs, South Africa has been recovering out of this major blip and coming back into what we should be, keeping the infections as low as possible for now.
Prof, always a pleasure speaking to you. Thanks so much for making it so understandable for us that are anything but scientists. But all I know is I feel like we've got balls coming at us at every angle. I'm not sure which direction to duck in anymore. Medical Expert Prof. Ramneek Ahluwalia, thank you. Have a wonderful day and thanks for talking to us. All right, gone 8 o'clock. Let's get into our news.